My name is Angela Dispenzieri. I am a physician at Mayo Clinic, Rochester, Minnesota. Um, I have an interest in Castleman disease based on seeing those patients, but also I take care of a disease called, or patients with a disease called POEM syndrome. So there's a big overlap between the two. So that's sort of my in to Castleman's and some of the research I've done interested in Castleman's based on my experience with POEM syndrome.
I see. And then how did you get introduced to the CDCN?
Yeah, so I mean, I've known Fritz van Rie for a while, and I had published a couple of papers on Castleman's, and so I was invited kind of in, and I'm impressed and amazed by all that they're, doing. Such a young organization, and really going to make a difference, and already are making a difference.
Yeah. And so what advancements or research maybe that you're even doing are you excited about going forward for Castleman disease?
I think, that there'll be the opportunity to do some actually things that are kind of simple to start with. So the registry, I think, is going to be very powerful because it's such a rare disease that so much of what's in the literature, a little case here, a case there, and it's a lot harder to do pattern recognition and really understand differences and sort of pulling apart groups of patients to understand what works best for different populations. And so I think that that's going to be really very powerful to just start to pull patients together and then have the opportunity for, sort of either a virtual or a real biobank where patient samples then can be pulled together and interesting questions asked to try to really get to the bottom of these diseases.
Yeah. What would you say to patients who are looking for more information?
Well, definitely, this is a resource to get information and going, to the web page and sort of signing up to participate. And I think that those are all good things.
Mm-hmm. And what about other researchers or practitioners who are looking to be more involved?
Yeah, I mean, I think that, the more involved, the better, certainly. It's hard with rare diseases because, people may not see, one in 5, 10 years or even a career. And so, but I think anybody with an interest certainly should, be working on it and trying to help